afternoon. To start off, let's talk a bit about dreams. We've all had these dreams since we were children, like becoming ballerinas, athletes, neuroscientists, researchers, and business people who make tons of money. Well, my dream career is pediatric anesthesia. My name is Anika Singh, and I am pursuing pediatric anesthesia as my topic in ISM this year. My goals are to create a final product that will help someone to network with professionals to prepare for the future by gaining knowledge. But most of all, I want to create a positive mindset by thinking about the future and thus preparing for the future, because as Buddha says, what we think, we are. So here's an overview. So far in ISM, over the past couple of months, I've been doing research. There's secondary research, which is through databases, and primary research, which is by conducting interviews with actual professionals. So we have some current problems and debates, which are problems that I have found to be prevalent in pediatric anesthesia today. So we have airway complications, the effects of general anesthesia, both long-term and short-term, on neurodevelopment. And the debates are which type of anesthesia is best and what could be done to improve pediatric anesthesia as a field. First, let's talk about airway complications. So, one of the most important orders given by doctors before surgery and before anesthesia is given is a fasting order, which is called NPO. So this is to prevent aspiration, which occurs when you've eaten something and then when you have the tube placed, the tube that gives you your anesthesia, when that is placed, the gag reflex occurs, and then you basically throw up your food, and then you breathe it back in, which I know that sounds disgusting, but it can also be fatal because it can block your airways and prevent you from breathing. And it can also cause bronchospasms, which is when your airways, they constrict and you can't breathe because your muscles are involuntarily in action. So as you can see, this is aspiration pneumonia. The red line is the area of pneumonia, and basically that occurs when you aspirate or you breathe in some stomach matter, and that basically develops an infection in the lungs. So what are the effects of general anesthesia? First, let's talk about short-term effects. So directly after you come out of anesthesia, you have a lack of muscle control. So one of the most common events is you can't control your voice box anymore, so you can't speak, and also bronchospasms, which were mentioned earlier. Because of the bronchospasms, you can't breathe because you have no control over your lungs. Another effect is a headache, which occurs for many days until the anesthesia is gone from your system. These occur because the anesthesia binds to your cells. So basically, general anesthesia does affect you on a cellular level. As you can see, the red circles show where the neurons have bent because anesthesia has bonded onto it. So this changes the structure of your neurons, but also the function, because the signals cannot travel as quickly. Dr. Kara Esser, who I did an interview with last week, she said that many patients, after they undergo general anesthesia, especially babies, they're not as aware and they're more irritable to surrounding stimulus. So there is a possibility that there are long-term effects of general anesthesia, because when children, when patients who are pregnant present for surgery, it's avoided to have surgery and general anesthesia done upon them because it may affect the children's neurons, especially in the first trimester when the brain and the neural tube are actually developing. So, what are the effects of general anesthesia in the long term? So this is actually one of the most widely debated topics today in pediatric anesthesia. We have different time periods. So within a year of having general anesthesia, many children face many psychosocial behavior changes, such as anxiety and irritability. And when talking about anxiety, separation anxiety is especially emphasized, but this can also be attributed to trauma from undergoing surgery. However, the 10-year mark shows something very different. In a study that was done on children who were 10 years old, so their mothers had general anesthesia done when they were in labor and when they were having C-sections done. So there were no lasting effects. There were no lasting psychosocial effects. So they had no differences in autism, ADHD prevalences, and there was no changes in anxiety levels, irritability, and other differences. According to Dr. Esser, one short period of anesthesia is okay, but longer periods or multiple periods do have lasting effects. So what is the best type of anesthesia? There's spinal anesthesia, which is basically an epidural. You inject anesthesia into the spinal cord. There's general anesthesia, which is when you basically just put a tube down your windpipe and the anesthesia is given that way. And there's local anesthesia, which you might have seen if you've had dental work done, which is basically an injection into a specific part of the body, and it numbs only that specific part of the body. Spinal anesthesia is, from what I've researched, the best part because the patient is awake, but they don't feel anything. Because they're awake, they have better recovery times. So basically that means that they have no problems breathing because they have no tube down their tracheas. General anesthesia is more widespread, so that's one of its pros. There's more trained professionals who have experience in this, so it is safer due to that, and also due to the immense amount of research. Local anesthesia, it's not as good for invasive surgeries, which is what I'm focusing on, because you cannot give local anesthesia as effectively for deeper areas, such as if you're having surgery done for appendicitis. So what improvements could be made to anesthesia, especially pediatric anesthesia? So one of the most important things is parent education. Children cannot effectively make decisions for themselves, so parents need to be educated about their children's health. Parents actually decide anesthesia, the type of anesthesia their children receive, and they are responsible for enforcing fasting before surgery, which can stop many fatalities. Another change that needs to be made is smaller sizing of medical instruments such as breathing tubes, because think about it, if you have a larger, like a wider breathing tube that's placed inside of a toddler, that's not going to fit very well, and that is going to do some structural damage. So in conclusion, ISM has given me the opportunity to research and learn more about my dream career, and it has led me to realize that by thinking about my future, I can improve my future. we're excited, and thank you. This is a QR code for my digital portfolio.
Yeah.